Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary for the medical knowledge to general people and for reference to medicals. Today I am going to discuss about the upper respiratory diseases. They are acute laryngotracheobronchitis, acute epiglottitis, spasmodic laryngotracheitis, etc. Inflammation of the larynx produces a symptom complex called cough, having a triad of symptoms barking cough, stridor and respiratory distress due to obstruction of the larynx. Clinically, three types are described. Acute laryngotracheobronchitis, viral cough, is a very common and occurs in children of age of 6 months to 3 years. The causing organism being the virus, adenovirus, respiratory syncytial virus, para-influenza measles and influenza virus, etc. Symptoms. The onset of the disease is gradual following an upper respiratory infection with stridor, cough and wheezing. When laryngeal obstruction increases, dyspnea and intercostal and subcostal recession appear. If the obstruction is complete, asphyxia ensures. Treatment consists of the relieving of respiratory distress by means of a mist in a cough tent in hospital or steam inhalation. Steroids may be used with good relief. An airway must be provided where there is no improvement with medical treatment. Acute epiglottitis is also called bacterial sea cough. It is generally an infection of older children of 3 to 6 years and the pathogens are H. influenzae type B, beta hemolytic streptococci and pneumococci. Symptoms. The child may suffer from a slight cold for a day or two, but all of a sudden become acutely ill with a harsh, croupy cough, high fever, inspiratory stridor, dysphagia and dyspnea. The throat and particularly larynx appear hyperemic and beefy red. On examination, examine carefully to exclude the laryngospasm. Diagnosis. Throat swab and blood culture and sensitivity helps in diagnosis and selection of the antibiotic. Treatment. The treatment consists of selecting suitable antibiotic like parenteral ampicillin 200 to 300 milligrams per kg per day or penicillin in adequate doses, tetracycline or chloramphenicol in children sensitive to penicillin to combat the inflammation. Maintenance of airway by nasotracheal tube or tracheostomy is indicated. Acute spasmodic laryngotracheitis, laryngitis stridulosa, cough. In this case of laryngitis, where the adductor muscles of the larynx go into the spasmodic contraction, it occurs particularly in nervous infants below the age of 2 years, especially at nights when the child wakes up from a quick sleep, frightened, gasping for breath. Clinical features. The face may be suffered and cyanotic. After an hour or so, normal breathing is restored. Such attacks are self-limiting but may repeat on one or more subsequent nights. Treatment. During the attack, everything possible to comfort the child is done. allowed to adopt the posture he finds most comfortable for breathing. Administration of sedatives are helpful and may afford immense relief. Antibiotics are not routinely required and likewise antispasmodics, cold humidification and early night meal may all be useful and ameliorate the symptoms and reduce the frequency of attacks. That's all about the upper respiratory diseases: acute laryngotracheobronchitis, acute epiglottitis, spasmodic laryngotracheitis. And in the next video I will discuss about some other disease. Thank you.